Good morning, everyone, or afternoon, depending on where you are. Thank you for joining us today. My name is Jessica Ehule. I am a Senior Public Health Project Coordinator here at CityMatCH. And if you all are on this webinar, you are joining us for the Getting Our House in Order, Addressing Internal Racial Equity CityMatCH Learning Network webinar. So welcome to everyone. And we will go ahead and get started. So this webinar was birthed out of a conversation with the Equity Action Group co-leads and some of the work that many of our communities and members across the nation have been working on, and we also at CityMatCH have been working on. So today we will be talking about the importance of addressing internal racial equity, and then also we will hear from 3 different perspectives about how these organizations have been going about internal equity, racial equity specifically. So you'll hear from me to represent CityMatCH, and then you'll also hear from our members at the state and local level. So our speakers today are myself. I'm pictured as there, the first picture, Jessica Ehule. We will also hear from Novais. She is a CityMatCH Executive Board member, and she is also the Executive Director of Health at the Rhode Island Department of Health. And last but not least, we will hear from Janet Jones, who is a lead health education specialist at the McLennan County Public Health Department in Waco, Texas. All right, so I will begin our conversation just to lay some groundwork in racial equity and where we are. A lot of you, if you've called in, you know about CityMatCH, and we work in maternal and child health equity. And when we talk about equity in our work, we're used to talking about making sure that our communities have all the needs they have. We're talking about social determinants of health. We're talking about racial equity in education and maternal and child health outcomes and housing and transportation and things of those nature. I have the diagram from the Robert Wood Johnson Foundation here looking at equality versus equity. And I think that nowadays we have a pretty good grasp on equity and what that is and what that means to us. But if you have not seen this diagram before, this picture here, the first one is equality, just giving everyone the same tools and expecting them to succeed and thrive given the same tools. The picture on the bottom is equity, giving people the tools they need to thrive dependent on their needs. And I think that everyone is comfortable with racial equity and what that means in our work. However, when we think about racial equity in our workplace, we often don't take the same level of diligence in looking at what we do, how we do, when we do, and thinking about how the equity we have inside our house may impact the equity work that we are doing in our communities and in the nation as we go along. So this webinar today will focus specifically on racial equity. Equity is many things. It can be on gender, age, religion, sexual orientation, but this one today will focus on racial equity. And we at CityMatCH just wanted to share with our members and with our partners the work we have been doing in-house to be intentional about addressing internal racial equity within our walls. So this is just a funny picture that I put up. And it just says, oh, you'll love working here. Nobody treats you any differently because of your age, race, or gender. And if you look at the picture there, all of the people there kind of look the same and maybe fall in the same roundabout age, race, or gender. So that was just a funny picture that I wanted to put up for everyone. So to begin discussing the work that we have been doing at CityMatCH, around the end of 2017, there was a group of staff members here in the office who came together and realized that there was some things we need to address in-house as far as equity, discrimination, bias, things of that nature, prejudice. So we all came together and developed a plan of action. I was one of the people that helped lead that beginning conversation. And one of the pieces that I think that was important in that was seeking some advice from a mentor to begin with. So if you feel like this is an area you would like to embark on in your workplace, I would say seek some advice and maybe talk to a trusted source. And then after that, we had to create a plan of action to bring this to the attention to our leadership, to staff members, some of the things we've been seeing. So the first thing we had to do really was to acknowledge where we were at that point. And I think that is vital in any first steps of moving. You have to acknowledge there is an area of opportunity here. So that's where we had to start. We then went on to set up a meeting with our executive director here, and we sat down, we created a presentation, and laid out some of the examples of discrimination, prejudice, bias, things that may be going on in our office that might not be known, that might be known, that we need to address internally in order to move our efforts forward the best way. So really being transparent about where we are and what we do, and really also thinking about where do we want to go, where do we want to be, and how do we want to make sure that these type of conversations are happening all over. So that was our first step, acknowledgement and sitting down and having a conversation. It was a very good, very productive conversation. And then in January of 2018, CityMatCH actually committed to internal cultural improvement. So this is a process, but there was just a point in which CityMatCH said we will work towards making sure that we have a space at work where everyone feels safe, comfortable, and invited to come and bring their thoughts, ideas, and feels welcome. So that included understanding that we will have difficult conversations, and there will be conversations that might bring up things that we're not super comfortable with. There will be activities we need to go through, things of that nature, but everyone was fine with that, and we began to embark on this journey. So just to give you a dive into what that looked like at CityMatCH, at the national level here, we're just telling you exactly what we have been doing and what we continue to do. This is not something that we have solved. You don't reach racial equity and then you put a check mark by it and you move on. It's just something that continues to evolve. So these are some of the things that we have done in-house as we begin to address some of these things. So one of those things is the external trainings we have done. So we've done trainings around, we started with trainings around just developing tools, learning tools to address any instances of bias, stereotypes, things of that nature, and that was called the OUCH methodology. And if you haven't heard about that and you're interested in learning more, feel free to reach out to me. But that is where we started with our external trainings. We also participated in some implicit bias training as a group. And this year we will engage in a healing circle opportunity as a staff and board, and then also as a staff rather, and then the Racial Equity Institute will be, staff and board will participate in that. There was a small cohort of staff members who were able to attend a Racial Equity Institute training previously provided in North Carolina, and so we went to see kind of how they ran that training to see if that was something we could bring back to our full staff, and we decided it was, and so we decided that it would be best if our full staff and board went through this training. So those are just a few external trainings, and as we all know, cultural competency trainings, bias trainings, that's not a fix necessarily to this. This is just one of the many methods that we're using to begin to address racial equity within our walls. A couple of other things we've done include just having an internal dialogue. We have become like a very transparent office. We are open to having conversations with one another. We're open to just thinking about ways to do things differently together. So we've had trainings in-house led by staff members just about racial equity and where we are individually and the importance of it, that we all find how important is it to all of us. Where would we like to go in a year and 5 years from now, things of that nature. So we begin to have those conversations. And then this year we will probably also be doing a book club because we've been introduced to several different books that will assist us in just becoming well-versed in racial equity and understanding what that means. And as we are a national partner, we want to make sure that we're able to assist our partners, our members that might want to embark on this as well. And then this year we have also been able to review our progress and just refine our plans of action so that we have a plan for 2019 moving forward for what we will be doing as far as our internal racial equity work. If some of you were able to attend our pre-conference training in Portland this past September, we did a pre-conference training kind of based on this work we've been doing, but also just talking a bit more about implicit bias and what that means in the workplace a little bit more in depth. One of the things that came up, and I think that one of the things many of you on this call may be thinking about, is how do you begin this type of work in your office? So I just shared with you the way we started. We started with a conversation, an honest conversation, and then set up trainings and had some conversations around our table to begin to do this work. But everyone is starting from a different place, and we are very, very cognizant of that fact. So it is important to lead from where you are. You do not have to be a person in upper management or leadership to begin this effort. I am a project coordinator. I am not in a leadership, formal leadership role, but it's important to realize if you're beginning to embark on this work or if you're leading any effort, you are a leader. So I would argue that even though you don't fall in that specific role, you're doing exactly what you need to do in that space. Some of the things that were helpful and beneficial to me as I began to have these conversations and lead this work were the awareness piece. So realizing that there is an issue at hand, realizing that there's something to address, and making a plan to communicate that fact to everyone in the office. So that effective communication skills piece, I created a presentation. What that looks like for you might be different. Maybe you're able to speak to someone in upper management who can then speak to others. That method is totally up to you and dependent on your agency and what you know is best for you all. Building relationships is really important. So I feel like in our office we have a pretty high level of trust, and we can go to each other's offices and sit down and have an open conversation and understand that the person will at least listen. So building that relationship. Also, just being honest, I think, and having integrity. So just being really open and honest, being respectful, but open and honest about the issues at hand that might be there that we could address is key. I don't think that there is anything wrong with being honest. I don't think that you should sugarcoat necessarily or anything of that nature. Be honest about what's going on and just have a very real conversation. And that last part was the organization and planning. So that is in developing your communication plan, but that is also in developing a plan to begin to address this within your workplace. And there are several resources out there that you can use to begin to address this type of work. And just a few pearls of wisdom, as I call them. There's a few things that if you are thinking about beginning to address internal racial equity within your work, first, just having that courage to act is majorly important. Having that courage to speak up or have a conversation or start to think about how could we begin to tackle these things. That courage to step up and do something is that first step. That's the thing that will propel everything forward. That's the catalyst. So also find your allies in your peers and in your mentors. So if there are people in your workplace or maybe even people outside of your workplace that can help you talk through the conversation, make sure you access those people, talk to them, and develop a plan with them and run some of your ideas by them so that you go into this with a bit more solid foundation of what you're doing. Also commit to being a lifelong learner. in this work, you don't just stop learning at any time. So it's not like you reach a level of racial equity and check, you're done. Like I said at the beginning of this call, you don't reach a point and then it's like, bam, we've done it, we're good. No, just continue to learn, commit to that point, and every person has something to learn. So be open to that as well. Utilize any resources and agencies that are leading this work. There are several out there. CityMatCH is a maternal and child health organization, so we have pulled on the work of other agencies out there who lead some of this work to begin to do this within our own house. And then also just building organizational ownership of addressing internal racial equity are some of the key pieces, in my opinion. So in the spirit of a new year and New Year's resolutions, I put 2019 is our year. So in 2019, CityMatCH will continue to do some of this work. As I shared previously, we have a healing circle lined up and also a training with the Racial Equity Institute. We will also have quarterly in-house staff-led meetings around racial equity, as we have at the end of last year, so we'll continue to do that. And as you begin to do this work, please do commit to learning from your failures, learning from your successes, learn from each other. It's okay to fail. It's okay to ask questions. It's okay to sit down and have a conversation. But there is a bit of openness that everyone should have in doing that. And yes, we do understand that not everyone is starting in the same place. So remember to start where you are and embark on your journey. Wherever your journey is beginning, that is your journey. Your step one could be just sitting down and having a conversation about stereotyping or addressing a stereotype when it comes up. That could be your step one. And if that is your step one, that is no less than sitting down and having a conversation with your leadership. All right. Well, I just wanted to share very briefly what we are doing at CityMatCH with this work in-house and how we began doing that. I will now turn over the mic to Anna Novais in Rhode Island, and she will tell you about how the State Department of Health has begun to do their work around addressing internal racial equity.
Thank you very much, Jessica, and thank you so much for sharing what the CityMatCH staff and CityMatCH leadership has engaged. As a member of the board, I'm looking forward to continue to support that journey and to learn from you all and to adopt that on some of the things that we do here. Good afternoon, everyone, before I forgot. Just to pick up from where Jessica left, and one of the important things that she said about leading from where you are, and I wanted to restate how much of this journey, it's part of it's a personal but also organizational journey. And I think I'm going to be talking mostly about the Rhode Island DOH journey in achieving health equity, in addressing racial inequality in our own way as a state public health agency. But I wanted to support Jessica's comment in saying that it was also part of my own personal journey. I came to the department early on as an education and outreach coordinator. That's how I started in public health. And as an education and outreach coordinator back then, I was working for the immunization program and for the childhood poisoning prevention program. And I remember thinking to myself feeling that most of the things that I was doing weren't impacting the people that needed to be impacted, and feeling that I was powerless in a sense and could not really refocus what I felt was needed in our program as a public health agency to be able to address specific needs of the community outside. So there was a lot of that going on inside myself and me trying to push an agenda that wasn't moving forward, because as an agency we weren't focusing necessarily in addressing racial and racial inequalities in health. And so fast forward a few years, and I applied for a position as the chief for the Office of Minority Health, and it was a challenge for me because I wanted to start to be able to do that, but big name, Office of Minority Health, and it was me. basically still, it was a different position, a pay grade, an upgrade, but it was just me, which did not really reflect, from my perspective, a commitment as an organization to change. And so I started very at the beginning to really try to build that infrastructure and try to understand how, from just me, Chief for the Office of Minority Health, what kind of impact could I have and how could I lead a process within this organization of almost 500 staff people to change and to adopt an agenda that was mine. And so in terms of seizing the opportunity, which I think is another concept that you kind of saw through Jessica, that opportunity for me came along when we were doing Healthy People 2010 assessments, and that could be my next slide, please. And so I don't know if you can hear me, next slide. And so when we were doing our review of Healthy People 2010, this data point gave me personal pause, but I seized the opportunity and tried to make a point for our staff and for our leadership in the department. So for the first time in modern years, we knew that the next generation, our children's generation, had a lower life expectancy than previous generations. And while for some that may not be new, I seized the opportunity to say to folks, this is my children, this is your children. How can we accept that? And next slide, please. Next slide. I also saw and showed them, looking at Healthy People back then, how much we have very limited improvement within our racial and ethnic communities. And so Native Americans, I don't know if you can read it very well, but basically for the Native Americans in Rhode Island back then, you could see that only from all of the indicators that we were tracking, we had made improvements only on 5 indicators. But we had made, in fact, no change or gone in the wrong direction for 13 other indicators. For African Americans, we made improvement in 12 indicators, but for 18 indicators, we made no improvement or we went in the wrong direction. Asian and Pacific Highlanders, the same picture. Improvement on 9, 15, no improvements or going in the wrong direction. And so that picture, next slide please, which also is reflected here, led me to be able to approach the organization leadership and say to them, we need to do something. As an organization, we need to change, because unless we change internally as an organization, there is no way we're going to have the credibility to lead the change that we need to lead to change those outcomes outside. So next slide. We, based on that, we came up with a new vision for the work that we needed to do. So the vision that we put forward is that we needed to achieve health equity for all populations through elimination of health disparities and assuring healthy child development, preventing and controlling disease. It was just a way of refocusing what had been our vision and mission for the department, but without a specific focus on health equity. Next, please. And so we also made sure that folks understood that we needed to, if we wanted to change, we needed to also reorganize ourselves different and have a different focus on how we were going to be doing our work. So we focus on community, family, and equity, trying to achieve every optimal health for everyone. So next slide. It led us to say, so if this is what we are saying that we need to do, there was a need to internally also restate the values that we were going to be using, not only in the work that we did internally, but in the work that we were doing with our partners. And so we wanted to make sure that we focus on diversity. Diversity, we mention it because not only we needed to be, as we challenged the organization, we said we need to look differently. At the time, as the Chief for the Office of Minority Health, I used to attend what were the meetings of the executive team of the department. I was the only person of color in that department, in that leadership team, and there were only 2 women in that leadership team. very representative of the society that we live on, where power is equal in most times with white men and income. And so we needed to really challenge that reality back then and say, how do we bring more diversity into our staff, not just at the entry level, but at management and leadership level. We wanted to make sure that we restated the value of health, equity, and social justice, saying that we will be using that lens throughout the work that we did outside with our communities, but also how we looked at our work plans and the work that we were doing inside, and how we valued and supported and trained and gave the skills and the tools that the staff needed to engage in this work. As Jessica mentioned, the need for open communication. There is no way you can have these kind of conversations and having this kind of cultural shift and change within an organization if you do not have open communication at all levels, from top to bottom, from bottom up. The value of teamwork, you cannot do this on your own. It doesn't matter how loud you are. You may be getting some attention when you are very loud, but for the work to move forward, you need to be able to hold everyone together, and that people need to be willing to sit down and have that conversation and have that commitment to move forward. And then accountability. We wanted to be accountable to not only the values that we were putting forward, but to the needs to change as an organization, and then ask that same accountability of our partners outside. And because we are public health, needed to be data-driven and science-based, and so we didn't want to take it one-off. We wanted to make sure that whatever training, whatever tools, whatever change in programmatic interventions we were going to be proposing, they were led by data and they were science-based. So next. Because of that, we developed new priorities, and I'm not going to read those, but they are reflective probably of every other department in public health. So next slide. But they led to the development of a new framework. And so this journey that I'm describing to you, it's keeping our internal house in order, but it was led also, as I said at the beginning, by a desire to change and a plan to change how we worked outside of the department. And they needed to come and happen kind of in parallel tracks. And so the new health equity framework, that's the framework we said we were going to be using in terms of changing how we organize our programs internally and how we develop the programs externally. And we call it the health equity framework. We said we needed to be focusing on addressing the social and environmental determinants of health, and I'm not going to need to talk about that. You know that life course developmental approach. You are MCH professionals. You know what that means. We talked about a lot of program integration because we wanted to be able to leverage resources and do better as we engage with our community. And then we talked about social and emotional competency, which was mostly turning internally because of what we needed to do to change internally, learning to listen to each other, learn from each other, and then be willing to engage in a journey of change. And then, as I had mentioned, collaboration and partnership. So next. I'm not going to, it's just for you guys to read later. It's one slide on social and environmental determinants that I'm not going to focus on. Next one. Life course developmental approach. We know about the timeline. We know about timing. The next one. We know about the environment and how that is what really affects our capacity to be healthy. And we definitely know about equity, how much our inequalities in health and our inequalities in life are more reflective of things that are not connected with genetics and with individual choice. So next. I was showing you a curve of the trajectory that reflects on one little brief example, all of the issues around what we were talking about, the impact to the timeline and the timing and the environment, and it's just a nice picture that shows how your developmental curve can be protected or can be depressed depending on what your experiences are. And I liked to use it because it applies to us as individuals. It helped the staff. I used it at trainings because it helped the staff think through and say, this is not just for outside people. This is not what we're teaching in MCH trainings. This is what happens to us as individuals, and that was an important connection for folks to understand. So next. In terms of program integration, we wanted to focus on the program integration because, as I mentioned before, it's the only way you can really, when you are addressing these cross-cutting issues, you can do that. It helps us just do a better job. And it created very much new avenues for us to be able to do our work. So next, we committed, next slide please. Through this program integration, we committed to the development of a common vision, making sure that we are agreeing what we were going to be doing. We commit to have joint leadership, and that means changing the way we've done our business internally and bringing into a leadership position folks that came from different perspectives, had different point views, but would contribute to that common vision. It led us to do joint planning, programmatic and quality improvement initiatives, and seeing how we could work differently together, establish common outcomes, establish common policies, which was so important for us in terms of how you then develop the work that you need to develop, how you allow for better in terms of a legislative policy, in terms of common communication message internally and externally, integrated advocacy strategies, and how we created also common mechanisms for community input, for empowerment, for integrated training and technical assistance to our partners outside and also for all of us inside. So next. This is a picture, basically, of that framework and bringing together all of those things that we did. And using this picture, this reflection of the framework, the life course, the emotional and social competency of ourselves and our staff, the need for collaboration, integration, and partnerships, and then looking at all of those levels, we developed what we call our 4 equity questions. So next. And our 4 equity questions, it's questions that we ask. So we met with every single program and team within the health department, and we asked these 4 questions. What does achieving health equity mean for your program and for your team? How comprehensive are your interventions, meaning related to that equity pyramid that I showed you before? If you are not addressing, why and why not, and what are you doing? And most important, because it led to what we needed to do with the staff, what support will your program, your team need in order to develop a comprehensive public health program that addresses all of those levels of that pyramid and that's using these equity lens and focusing and the social justice lens. And so next, that led to what we call our 3 big strategic challenges as a department that we needed to address internally in order to move forward. That we needed to definitely build the capacity to collaborate internally with this lens of equity and social justice, that we needed to adopt a community development frame to the work that we were doing, and that absolutely we needed to build a shared public health equity agenda, not only across the state as a state itself, but across our partners and internally, that common vision. And so the next steps we took, so next slide, we met with all of the teams, as I said, in terms of the 4 equity questions, and then we responded to the strategic challenges, and I'm going to be and we did some of the work that we did in terms of grants review process. That was one of the ways to focus the work outside, the way we did our local investments, and I'm going to be focusing on the work of the staff training and responding to the strategic challenge. So next slide is our strategic challenge number 1, build capacity to work, to collaborate internally. We developed what we call a health equity grant checklist, Staff used to say to us, I don't know how to do this work. I don't know how to address. My grant has nothing to do with that. So we help the team by having these health equity grants checklist that just guides the staff through a series of questions, self-reflecting on the general guidance that they receive with this social justice and equity lens. And so the story that we start telling across the department allow for those conversations to happen at the programmatic level. We also, as I had said, did the equity pyramid exercise with all of the teams and all of the programs, which again led to a lot of conversations internally about who are we serving, how are we serving folks, what does that mean that our management is all white folks or that our health educators are all white when they are engaging in Spanish-speaking communities? What does this mean in our team? Why are we hiring folks that do not look like our community, and all of those? Then in terms of, we did what we call maternal and child block venture capital investments, where we challenge our staff to, for every year as we look at our maternal and child health block grant, instead of us developing a budget from the get-ground, and this is just an example, we had the staff work with community partners to come up with proposals of what was work that had been prioritized, and they needed to justify that work using some of those 4 questions, the same 4 questions that we had engaged with them before in terms of the equity exercise. So again, trying to have the staff engage in those conversations by also bringing the work that they needed to do along that. We developed what we call core competency equity training, and that was a training that had 8 modules and that we had all staff attend. And all staff attended that training, focusing on all of the addressing the isms, some of the racism conversation, communication, how you talk about it. And we did it again, both focusing internally and externally. So what does that mean internally as an organization, as a staff person working for this organization, and how does that then also translate in how you engage with your community partners? And at the other leaders training we did, we had a leadership retreat where we brought all of the leadership team together, and that was just this past year. So I'm talking about a 10-year journey in here. We brought the leadership team together to make sure that we focus on, again, the notions of equity, taking stock of where we are. Are we all having the same understanding in terms of equity, of what needs to happen or not happen? Have we changed as an organization continuously in this journey? We brought program managers to have that same exact training, and then we did a visioning exercise that included every single staff person with the health department, where we asked them a few questions in terms of how do you see the department from the lens of equity, what do you need to do your job, all of those same questions that we were asking, we asked every single staff within the health department. We made some changes in terms of organizational structure, and we created what we call safe spaces around the department. They are not physical spaces, but they are groups that are led not by, they are staff-led, and they come from the interest of the staff, and they all focus on issues that from their perspective needed to be addressed from a social justice perspective. First one is what we call our SOGI. It's our it's our sexual orientation and gender identity work group, and it was a group that came together led by staff. One of them is a staff person from one of the co-chairs. It's a health educator for the cancer control program. So it has nothing to do with leadership, but people get together and have developed comprehensive agendas of how do we need to address internally as an organization some of the issues and externally. One of the outcomes of the SOGI group, for example, is that the department now has, one may think it's not a big deal, but it was a big deal for us. We are the only state agency that has that, all gender-neutral bathrooms. That's how much we needed to change, as an example. We have a social justice roundtable that has tackled issues such as community policing, the Black Lives Matter, all of those things. They bring those issues and create presentations, discussions, and those are spaces where the staff comes together outside of organizational, where they reside within the organizational structures to have these kind of conversations. They saw, for example, they had a showing of the 13th documentary. And then we have a CHAG as another example, which is a group focusing on what does measuring health equity means and how do we come up with health equity indicators that we can use across all programs within the health department. So that's strategic challenge number 1. So strategic challenge number 2, next slide please, adopting community development frame for our work. This is the work that we do with HAS, next slide, which is our health equity zones, building healthy and resilient communities across Rhode Island. I'm not going to talk about that. That will be its own presentation, but basically it's a shifting how we have done all of our investment in the communities by having place-based, community-led initiatives being the way we do public health at the local level. And last but not least, the strategic challenge number 3, how do we build a shared public health equity agenda across the state? So we did ongoing presentations at any place that wanted to hear us and to get us talking about how we were changing as a health department, talking about our challenges in this journey, the things that we needed to do, the things that were still needed to do, and to start creating awareness, as Jessica mentioned, of these issues internally but also externally. We have a Commission for Health Equity and Advocacy that is it comes out of what used to be a department-led commission, and it became now a statewide commission focusing on health equity and advocacy that is every 2 years develops a plan for the state that requires all other state agencies to engage to talk about health equity and advocacy. And last but not least, we have developed new strategic priorities and public health goals. Next, please. Next slide. And those are overarching priorities for the department. We wanted to make sure that we statewide, it was clear what was leading us. And so those are our leading priorities for the department. Next, please. And we also developed strategies and integrated population health goals and metrics that are for all state agencies and not just for the department. So next, it's a very busy slide. I'm not going to go through them, but for every one of those strategies, we have developed population health goals that everyone is achieving. And hopefully, next slide, please. This will lead to a change that is outside, and instead of having this very messy slides that it's really what you see right now in the outside world, it will lead to a more integrated and seamless system where all of those systems are connecting to each other. The way we see internally that we can help support that, having this outside agenda, but internally staying focused. I think it's important in terms of lessons learned to continue to stay focused. As Jessica mentioned, this is an ongoing learning journey that we need to engage as an organization. So staying focused, continuing to be intentional about every single step that we take and every single new engagement that we have, it's critically important. And at the personal level and for our staff, what we say to them, to continue to challenge yourself as individuals, your colleagues, and your organization to be open to have these conversations. And so the importance of having authentic engagement, not being afraid to challenge and be challenged, but also to create an environment where it is safe to have these conversations, because those are not easy. And so all of the trainings that I talked about, all of those systems are things that cannot be a one-time check. You need to constantly continue to do them because staff changes. But even those that stay, we need to commit to this journey of learning from each other and changing so we can better serve those that we serve. So thank you. I will stop now and let questions be later. Thank you.
Thank you, Anna. Really appreciate that. We have seen the questions that came in the chat box, but we'll answer the questions at the end of the webinar after Janet's piece. So I will now turn it over to Janet Jones.
Hello and good morning and afternoon for some people, depending on what time zone you're in. We are going to go ahead and get started. I'll lead with an overview. So next slide. So I serve as the lead public health education specialist here at the Waco-McLennan County Public Health District in Waco, Texas. And so I'll kind of give an overview of who we are and what we do, a very simplified race equity definition, share a little bit about the Waco-McLennan County Public Health District's work toward racial equity, some actions made towards change, other opportunities for continued improvement, how to begin this work locally in your community, and then how to tap into some networks to support racial equity in your local community. And then we'll end with summary and questions. Next slide. So who we are, the Waco-McLennan County Public Health District, which I'll refer to as the Health District throughout the course of the presentation, is the local health authority here in McLennan County, with Waco being the largest city that we serve. The County Health District is a part of the City of Waco. We are actually one of the departments under the City of Waco, but we also service all of McLennan County. There are about 82 employees, and each having work under each of these 6 key divisions listed there: administration, environmental health, public health nursing, HIV/STD, lab, vital statistics, and billing, and then women, infants, and children, WIC. Next slide. The leaders within these divisions are program managers, are charged with executing the public health programs and services in collaboration with other staff, volunteers, stakeholders, community partners. So essentially those 6 divisions, those program managers, they are charged with helping to push forward the work of our health district according to our strategic plan. There is an advisory board. The health board is created to provide guidance on the different public health activities, give approval for some larger decisions being made, policy development, and essentially anything in terms of promoting the health for McLennan County through the health district. Our board kind of chimes on. It's composed of 17 representatives, 14 of which are government officials, 3 community representatives, and they're all appointed by their respective city, agency, or the county. Next slide. So to kind of get started in going into some of the steps that the health district took, I wanted to start with a very simple definition of race equity. It is not my definition, but it is one that resonates with me, and it's one of the simplest definitions that I've seen used thus far. And it's from this organization called Equity in the Center. And it's from their Race Equity Guide. They have a resource guide that's entitled Awake to Woke to Work, Building a Race Equity Culture. And I am actually going to highlight a couple of other slides later on from that same resource guide. The guide is created, again, by that organization, Equity in the Center, which is a project of ProInspire. But they work to shift the mindsets, practices, systems within the social sector to increase racial equity. And they work a lot with nonprofits or philanthropic organizations to help advance race equity in their work internally. And we'll, again, talk a little more about this. But when you think about this definition, the condition where one's race identity has no influence on how one fares in society, that can be whether we're talking in a school or educational setting where each child knows that regardless of their race identity has no influence on how their teacher views them. Whether we're talking about that woman, that pregnant woman or teen who walks into a pregnant woman or young adult who walks into her healthcare provider's office pregnant and alone, seemingly, knowing that regardless of her race, that person is not going to walk in with the predisposition or their physician having that thought that, oh, they must be single or they must not be married because they're an African American or Hispanic woman that's pregnant and coming in by themselves. So that condition where one's identity has no influence on how they fare or how they're viewed in society is kind of that definition I want us to hold on to. Next slide. So our director of the Waco-McLennan County Public Health District, Sherry Williams, was a champion or the champion in making race equity a focus. Our health district strategic plan that was from October 1, 2015 through September 30th of 2018 included a section dedicated to health equity, and it was strategic priority 5. Next slide. So this is kind of a sample of what that strategic priority was, and it was very kind of base level as we kind of got our foot in the water for this type of work, ensuring training for all staff on health equity and community engagement. Next slide. So this is kind of an example of how one division, HIV/STD service, was going to, that program manager was charged with ensuring the training for all staff in this area. And so for each division, that program leader is responsible for coming up with a plan for how their specific division would accomplish that priority and center race equity in their work. Next slide. The health district partnered with the Center for the Elimination of Disproportionality and Disparities, which I'll call CED for short, to offer learning sessions on health equity to the staff. The CED was a division of the Texas Health and Human Services Division located in Austin, Texas, and their role was providing equity training around the state by request. CED was actually formed in response to a Senate bill during the 82nd legislature, and then also in the 83rd legislature, responding to Rider 87 of Senate Bill in the 83rd legislature. They continued this work, being available to organizations across Texas to go out and do these presentations. That division is no longer a part of HHS, Health and Human Services, but the training opportunities that they offered then gave us a great start in beginning this conversation at our agency and being able to do it free of cost. And so some of the trainings that were hosted, you see the HHS equity curriculum. It was a full 8-hour, 8 to 5 training, and it kind of covered topics relating to just understanding what race ethnicity was. What do those terms even mean? Systemic and structural racism, analyzing the data and the impact of the historical policies and laws that have brought us to this point of the disparate outcomes that we see, and just really trying to build an understanding for staff at the ground level of why we're even having these discussions. And why it was important that it was a part of our strategic plan is because there wasn't an opt-out, right? Like staff couldn't say, oh, I'm busy or I'm doing other things, so I'm not able to attend. It was something that our director incorporated as a part of our system and said this is something that we are all going to be committed to and get on the same page to try to broaden our understanding of race equity. The other that you see there, the life course perspective. Of course, anyone who follows CityMatCH work is very familiar with the life course game that they created. This particular session used the life course game as a way of coordinating a more interactive conversation to be able to have this conversation. And so for those who are not familiar with the life course game, essentially the groups were broken into about 3 or 4. The larger group was broken down to about 3 or 4 persons, and you get together and play this game where each person is essentially assigned a different birth certificate, and you kind of have your life in terms of here's who you are, whether you're born into a single-parent home or whether you have a two-parent household and your parents have already saved for college for you, or wherever you're starting in life, and you're playing with your teammates across life. And so what it shows you is that as you move through life, you have these different setbacks, which kind of speak to your outcomes later on in life. So it was a really good, again, ground-level way of kind of helping staff understand what this work was and why we were having these conversations. Next slide. So identifying a champion was one thing that was important in starting this work, one who has the power to make or implement those changes. For us, that was, again, our director. Identifying key staff, one who is willing to lead this work within your agency. Our director, though she had the vision, she didn't have to be the one to lead it and to make sure it was happening, right? We had program managers who were making sure that they did what was asked and according to the strategic plan. And then there was also identification of other key staff who was willing to take this work on and kind of move it forward. And that was myself as the lead public health education specialist, and then our public information officer. And then lastly, equity plan, moving forward to kind of where we're going in some areas of improvement, having an actual plan, whether it's thorough, completely mapped out, still in the works, but having a plan of action and that is created to continue this work among staff is important, because those trainings over the course of those 3 years weren't just the end of our race equity work. We have to move on, and we're creating a new strategic plan, and so thinking about what equity will look like moving forward. Next slide. So this is kind of a sample, like sneak peek of what our quarterly equity training will look like once it's kind of fully fleshed out. Again, we want it to be incorporated into our next strategic plan beginning in this fiscal year, so that staff continues these opportunities for learning, but ensuring that it's on a quarterly basis, and it's not just something that's done once, but it's something that's kind of done on a regular basis with all staff to keep the conversation going. Additionally, in the past strategic plan, there was 6 sessions that were mandated, 2 per year over the course of that 3 years. And so with these quarterly sessions, it's going to increase the amount of sessions that are had, but it's also going to make it a little more organized and cohesive within the organization to allow for staff to engage in this learning together. Next slide. So some opportunities for improvement. Again, incorporating that quarterly training session into the plan for moving forward with our next strategic plan. It'll include mixing education, videos, slides, guest presenters, as well as small group discussions and activities into those training sessions to help it become more meaningful to the staff involved. One thing that both Jessica and Anna highlighted that I wholeheartedly agree with was the importance of identifying a staff person, and the fact that it doesn't necessarily have to be the leader, but that we're all leaders when we choose to engage in this work. And so regardless of what level in the organization you're at, being able to take on becoming a part of these conversations. And so because of that, we are going to create a core group of facilitators from the Health District who can begin facilitating these future sessions. So it'll grow from just 2 staff leading this work to hopefully having leaders from each division that want to engage and who feel comfortable engaging in these conversations. And of course, that requires the need to intentionally invest in capacity building and training for these individuals. Next slide. So the Race Equity Committee is another opportunity. As we have these conversations, we realize that the work in thinking about how do we actually operationalize race equity into our daily practice, that's not something that one person or one division can make the decision for. We do need key staff from each division and department chiming about their internal practices, their internal protocols, and how those things can be changed to begin incorporating these race equity learnings and these different training sessions that are being taught into the daily work and the daily practices. And so we see that as kind of like a final kind of last step in terms of really getting each department to kind of take ownership over this work, at least in this next sector. As we talk about a lot in race equity. It's not a one-time thing. It's continual conversations. And so how do we help everyone to kind of get on the same page in terms of this conversation? Next slide. So beginning this work locally, going back to the organization that I mentioned earlier, Equity in the Center, and their Race Equity Resource Guide. What you see there is their kind of race equity cycle, and it's, again, from a guide entitled Awake to Woke to Work, Building a Race Equity Culture. And one of the things that's highlighted in that guide is that there is no single right way to engage in race equity work. But there can be actionable next steps. While each organization might follow its own path towards a race equity culture, what their research suggests is that all organizations go through a cycle of change as they transform to this race equity culture internally. These changes can include increased representation within their organization, a stronger culture of inclusion, the application of a race equity lens for how organizations or programs operate, longer hours to accommodate the different citizens that might be coming in that are working and can't come in from 8 to 5. So whatever that change is, what research shows is that each organization kind of goes through these changes in a cycle, and regardless of where your organization begins on the cycle, there are different stages that you can kind of work through to help everyone get on the same page. As Anna highlighted earlier, a lot of this work is about internally each individual person. Like, we want to make change together as an organization, but the organization is made up of people. And so it's first understanding where you are as a person in terms of this title, in terms of this discussion and this subject matter, and just understanding where you are. Next slide. So some of the quick steps in that guide is establishing a shared vocabulary. So grounding your organization in shared meaning around race equity, structural racism, other terms related to this work. Those trainings that are being had, that bringing in speakers, all of those things are always one of the first things you hear is the different definitions for this work, whether we're talking health disparities, what race means, what equity means, what equality means, what diversity means. Those are all very different terms. And so first, having a shared vocabulary and understanding is kind of always that first step. Number two, identify race equity champions at the board and senior leadership levels. Selecting those who can set those race equity priorities. Again, for the Health District, it was our director. Communicating those things broadly, driving accountability, having people at each division who are responsible for carrying forth that vision, and ensuring the depth of race equity being embedded in the organization. Number three, race equity work as a strategic imperative for your organization. So defining and communicating how race equity connects to your overall mission and vision and organizational values. Number four, opening a continuous dialogue about race equity work. That's where we are in our planning and thinking about what happens next in our next strategic plan. Like, we want these continuous conversations, continuous dialogue about race equity work, so it's continuously being centered within our health department, within our health district. And then number five, disaggregating the data, collecting, disaggregating, and reporting on that relevant data to get a clear picture of the inequities or the outcome gaps in your system internally as well as externally for the population that you serve. This is important because when we look across all frameworks, whether we're talking about education, whether we're talking about health, whether we're talking about even the business sector, there are always disparities that we see. And so whether we're talking about looking at the different agencies in your community in leadership positions and CEOs and director positions, how many of them are people of color? Whether we're talking about in school and looking at the data around dropout rates or completion rates or test scores and looking at those students and disaggregating the data to see are all the students doing well? Are all students doing badly? Or are there some students that are faring worse than others? And once you look at the data, deciding of your organization and the things that you address, what are the areas of focus that you need to think about tweaking internally to try to address those disparities that you see in the data? Next slide. So the kind of last big topic I'll touch on is kind of building networks to support race equity. This work doesn't begin and end with the agency that's implementing a strategic plan and incorporating it into their daily practices, right? There are other community networks to tap into that can help assist any agency with achieving their race equity goals. And so for our community, I'm giving 3 examples of kind of some partnerships that we have that have allowed us to kind of bridge together our resources and aid in moving our race equity work forward. And so our local community foundation and local nonprofits, the Collective Impact Initiative, Prosper Waco, and then local coalition. Next slide. So Waco Foundation is our local community foundation. They strive to improve the quality of life for residents in McLennan County. Their mission is to make a positive difference in the lives and the future of people in Waco and McLennan County. And they do this through capacity building, grant making, hoping to assist nonprofits with different aspects of their work to ensure that they're reaching the population they need to reach and that they're getting the outcomes that they want to see. They are a funder primarily, but they're a funder that has stepped into a different realm of work than what you usually see community foundations take on. So Waco Foundation partnered with another local foundation, the Cooper Foundation, to bridge together their financial resources and begin hosting race equity trainings throughout our community. And so they contracted with the Race Equity Institute, REI, which we heard Jessica speak about. And this organization is based out of North Carolina, but they of course have trainers that travel all across the country. The training that they do here in our community, of course, is 2 full days. Typically, it's a Thursday and Friday or a Monday and Tuesday, 8 to 5, and there's a full historical scope and look over what has transpired in the U.S. over the decades that have contributed to the circumstances for people of color today. It's a deep dive experience that's coupled with reflection and debrief, and it's just a really great opportunity for those interested in bringing in outside speakers or presenters. But one barrier for some organizations is that they are not cheap. It can be expensive to host those trainings. And so having community foundations who are funders and willing and seeing the importance of this work allows partnerships to happen with different community agencies to send people to those trainings. And so that's exactly what we've been able to achieve. Our local community foundation usually will send out emails when they are having their next training to their community partners, and will suggest different people who should be in that next training. And so because of that, individuals that have attended at this point are CEOs of businesses, of hospitals, of our health centers, of our nonprofits. Leadership has all attended. Our police and fire chief, mayor, council members, family physicians, CMOs from our federally qualified health centers, as well as health district staff have all participated in these race equity trainings. And so being that we are a close community partner, it makes it easy for us to be able to kind of slide names in pretty easily to suggest those who we want to be trained, whether it's a community partner or stakeholder that we feel has an important role in the community and needs to understand this work deeper, or whether it's one of our own staff. And so our health education department has actually, the entire staff, every health educator has been through the REI training. And that's important because many of the community health programs and partnerships in the community are being led out of that department. And so having staff thinking with that race equity lens when they're developing community health programs or initiatives, when they're doing presentations, when they're deciding how to prioritize all the different areas in town and where are the areas of need that we need to be giving more health education to. It's really important and really crucial that they understand that equity lens. And so, again, working with someone else, like a community foundation that can fund these things and bring in an outside speaker has been something that was very, very beneficial. Next slide. Prosper Waco is our backbone organization of the Community Collective Impact Initiative here in Waco, and you see their mission listed there, to build an environment in which all members of the community are able to measurably improve education, health, and financial security. We've partnered with Prosper Waco. The Health District is the lead organization leading the McLennan County Community Health Worker Initiative. This is important because it brought several other community partners who might not have otherwise been at the table to have a conversation about how we can help better meet our community's needs. And so the Community Health Worker Program is one that the community have voiced that they wanted, and in working with our backbone organization, we were able to create that. For those that don't know what a CHW is, American Public Health Association definition, they're a frontline public health worker who is a trusted member and or has an unusually close understanding of the community they serve. So for our program, we have trained 12 community residents to become champions or community health workers within 4 zip codes. And those 4 zip codes are the zip codes of greatest need in Waco based on our past statistics and assessments. And so this program is important, and I highlight it because it's been truly centered on race equity and meeting people where they are and helping to remove access to quality health care. These CHWs, they engage in ongoing health education, promotion activities in the community, including one-on-one support and hoping to connect people to the health and social resources that they need to get access to health insurance or a primary care provider, ultimately with the goal of reducing hospital ER usage. And so being able to hear from the community what their barriers are, some of which was simply not knowing where to go, or when they call a different agency, they get 3 different answers when they call 3 different agencies. And so having a program that the community has come together to say, how do we better meet the needs of our community? That's, again, what we've been able to accomplish through this partnership, again, building those networks. Next slide. And then last but not least, I'll highlight another program of our department, the Healthy Women and Children's Coalition, which is focused on improving women and maternal and child health in the community. And so the Health District, in collaboration with many community agencies focused on maternal and child health, convenes this coalition. And so Health District provides the staff that takes the lead, and their role is to manage and lead this initiative. So in the spring of 2018, our coalition did some rebranding, and they voted to merge with the then Prosper Waco Women's Health Work Group. So under that Collective Impact Initiative, there was a Women's Health Work Group that was also working on women's health goals, and it didn't necessarily include as much about the pregnancy health of women, but still very centered on women's health. And so both groups kind of came together and decided it was better to address this work together. And so with that merger, the group utilized RBA, or results-based accountability, to help reestablish the strategies and the focus of the group. And they collectively voted on what's called a results statement. Now, the results statement is very much so like a vision statement, but it's essentially a condition of well-being for children, adults, families, or communities in the RBA context. And so, in other words, if our coalition work is successful, it's going to result in this particular results statement. And so as a collective, this group, not the health district leaders, but the group of agencies that we have at the table came together and decided what their results statement would be. And it was women and children of color in Waco-McLennan County are healthy. And so, of course, when we think about that idea of a group coming together and saying this is where the discussions need to be happening. That doesn't happen overnight, right? It's based off of getting that support from leadership at the health district, from leadership of other organizations who have been through that REI training, who are all speaking the same language, and getting to a point where we need to focus and center our women and children of color a bit more closely. That doesn't mean that we only have programming that is only centered on women and children of color and no other groups benefit. When that group numbers increase, the entire population numbers increase as well. And so it's this idea, when we look at the key areas of focus for the coalition, teen pregnancy, preconception health, thinking about health in the years before pregnancy, prenatal, the health of moms and prenatal care and the quality of prenatal care during pregnancy, and then interconception, thinking about postpartum access to care, and chronic disease and obesity, and those different areas for women after they've had their babies. All of those areas, when you look at outcomes, we see that women and children of color have the highest rates of the data that you don't want to see, right? We want to see the positive outcomes, and we see those groups having the less positive outcomes. And so we want to center our work on going where the need is. And so, again, through these partnerships, being able to have like-minded individuals who've all kind of been trained and having this conversation has been pivotal to kind of building that network in our community for race equity support. And so in summary, next slide, keys to kind of that we want to take away, finding a champion who's going to be a leader that can and is willing to make that change within your organization and will help with identifying that key staff that can manage the day-to-day process of incorporating race equity into that local agency. Partnerships, finding community partners and other like-minded agencies with access to the resources, whether financial or otherwise, that can help move the plan forward. And then lastly, do it. Make a plan. Make a plan to continue moving forward on your road to addressing race equity, regardless of how overwhelming or how abstract or how big it might seem. But just making the commitment that you're going to move forward and do it and do your plan. And that is my last slide, and I think we're at the point for questions, so I'll turn it back over to our facilitator, Jessica.
Thank you so much, Janet, for that. Thank you, Janet and Anna, for letting us know about the work in Rhode Island and the work in Waco. It's good to see a lot of overlap of things that people need to take into account if they are beginning to embark on this work. Before we move into taking questions on the line, there were several questions that came into the chat box, so I will read off a couple of those. The first set of questions for Anna, and Anna, this is more of a simple thing. Several people on the call wanted to know if you could share the equity pyramid and the health equity grant checklist.
Absolutely, I will send that to you right after the call, and you're free to share.
Okay, perfect. They also wanted to know if they have access to the training modules.
Yes, too. I can send that.
Perfect, thank you. So we will send that along with the webinar recording later this week, sometime before the end of the week. Okay. And also, several people asked if we would share the slides, and yes, we will also share a PDF of the slides.
And also the training, in fact, is in the, I don't know if folks have access to Train, but they are online on the Train system, TRAIN. So I will make sure that they are available to whoever wants to have access to them. We videotape the training.
Perfect. Thank you, Anna. Okay. Also, we will send a link to some more things around social determinants of health. One other question that came up was the life course trainings in Waco and how that looked. Janet, can you speak a little bit to that? I know you mentioned the life course game. Could you just speak to how that training looked?
Yeah, absolutely. Again, that was with our the SEED organization that I highlighted, the Centers for Elimination for Disproportionality and Disparities. and it was a part of the Health and Human Services Commission at the time. And so we worked with our contact there at the state, federal office, to be able to convene those trainings. And that particular one, the life course perspective training, was the 3 to 4 hour, and essentially the life course game was brought in by those staffers, and the group was broken off into different groups, and within our staff, it was all of us. We didn't have any outside participants during that particular training. It was all health district staff, and we broke up into 4 different groups and played the life course game for the first 45 minutes to an hour, was sitting and playing the game, and then afterwards we had discussions and Q&A session, and kind of got perspectives from everyone regarding what they felt about the game, and what different emotions came up for each individual person, and how that game, like how we can take that information and that knowledge and that discomfort that we felt during the game, how can we then kind of apply that to our daily work practices and look at areas for change or improvement. The life course game, CityMatCH might have more information about how to access it. We actually, here locally, we have just went and created them and just bought them and then actually blew it up and made sure we had copies of our own. We also partnered with a state initiative, the PPE program, Preconception Peer Educators, which was being done out of UNT Health Science Center, and we were able to get additional life course games from them. So CityMatCH might have more information on where you can get your hands on those games, but that's kind of what that session was set up. It was set up to be a more laxed environment, but to still be pivotal in terms of getting people to kind of think about how this relates to the day-to-day people that we see that walk through the door. Hopefully that answers the question.
Thank you, Janet. And yes, to speak on the life course game, excuse me, we actually have that on our website, so you can literally search in our web page life course game, and it'll pop up. You can print it out. As Janet said, they did there, blow it up and actually play the game. But if you have any questions, feel free to reach out to us here at CityMatCH, but you can access that online. It is something you would have to print out to play. It's not an electronic game, but it's very useful in explaining the life course. There was another question in the chat box about us here at CityMatCH and what we are doing to measure success, or how we're measuring success. And I hope that the little bit of background, that I gave to everyone was helpful. We at CityMatCH really have just begun on this journey. So in January 2018 was when we started to engage in different types of training and begin to have these conversations. During some of those trainings, or all of those trainings really, there has been some sort of evaluation at the end. However, we also have been looking to define more how we would like to measure success as an organization. So we're continuing to kind of refine that. We are utilizing a lot of tools from different organizations, such as racial equity tools, the Government Alliance of Racial Equity, various organizations that have already done work around this and actually have ways and examples and advice on how you can measure that. But we are taking all of those pieces and kind of looking at where we are. We're a fairly small staff here. To think about how do we assess how we're doing and the progress we're making, the successes we're having, and also identify those challenges at the organizational level, but also at the individual level. Since we are such a small office, it's important that there is transformative change not only for the organization, so that our partners, our members are also seeing that, but also at the individual level within our organization. And also, there is a local agency who has helped us do a little bit of assessment around where we are on a spectrum. So they have a chart that they have in the works that they've allowed us to use to look at our competency level and how everyone thinks we rank on this scale, and how we we all view that, and then allowed us to have conversation around where we actually are. So there are various ways that we're working on measuring success. Through this process, we have been keeping record of everything that we're doing, so keeping record of facilitation plans, things that have happened. There's been a lot of record keeping to make sure we don't lose anything, if that makes sense. Also, there was another question that came in the chat box, and anyone can answer this. This question was about, let's see, you've probably encountered staff that didn't see a problem and were resistant. What has worked to convince them that there is a need to address racial equity?
Oh, wow, this is Anna. Not probably, for sure. You find that all the time. And I think there's no specific recipe. It's going to depend, or a specific right answer. It's going to depend on how the question is answered. But what I usually use is just say until we all are healthy and until we all feel that we have access to opportunities equally, we are not collectively be in a good place. And so, but it's something that it's a constant. Why do you focus, if you are public health, why focusing on a specific group versus the others? So that's how I've tried to address. I don't know about you all, my colleagues.
Yeah, I'll chime. One of the things that we do a lot of is talking about the data. It's really, really hard to not see it visually when you disaggregate the data and you pull up any health concern in our community, whether we're talking hypertension, high blood pressure, diabetes, preterm birth, infant mortality, chronic disease, any health concern, teen pregnancy, and when we disaggregate the data, we see consistently that certain groups aren't faring as well as others. I think that's usually a great starting point to really showcase why we're doing this in the first place. As Anna said, you definitely have people who won't get it or who won't understand why the conversations are happening. But the more and more you can paint that picture, looking at the data, looking at graphs, line chart, whatever it is that you need to put up a visual of the data in your community, it makes a really good case and an example for why this work is so important.
And the other issue that sometimes people bring, which is along the same lines, is that we are doing well in general as a program. If, for example, it's a screening program and you are at 80% screening rate, yay, it's great. But then you say to them, yeah, but there's still 20% that you're not collectively, and if you look by racial and ethnic minority groups, you see that not all of those groups are 80%. And so you're never going to be beyond where you are right now if you're not able to bring those other groups up. And so that's the other way to show, which is exactly, as you said, through data, but having that conversation.
Thank you, Anna and Janet. I would echo the fact that you won't necessarily reach everyone in the same way. And yes, the issue with people thinking like maybe there isn't a problem to address comes up whenever you start to talk about racial equity. And I think the trick to that, there's no surefire way, but making sure that you try to address it with various methods. Like when we started here at CityMatCH, this internal work, we started with training on stereotypes and how to address them. And there was agreement that, yes, we all kind of use stereotypes in ways that maybe we shouldn't. So it was a comfortable place to start, a comfortable conversation to begin to have because they're like, yeah, there are ways that we could address that better. So looking for those places of opportunity to begin to have those conversations, they may not look like coming together and sitting down and directly talking about race in all communities, but finding the way that you can get there would be my best piece of advice because it is going to look different wherever you go. Okay. With that, we have hit 12:30, and I know that there are probably several other questions. We will send out all of the resources from Anna a link to our live course game on site, a link to this webinar. We will also be sending out the slide deck for this webinar, so it has everything you saw, including all of our contact information. So please be on the lookout for that. That'll come out sometime this week to your inbox if you were registered to this webinar. Thank you to everyone for joining us. Thank you, Anna and Janet, for participating in this webinar, and I hope this was useful to everyone. We will continue to have these type of conversations on CityMatCH's Equity Action Group calls. So if you are interested in joining CityMatCH's Equity Action Group, please contact me. You can go to our website and find my email address. It is just jessica.ehule@unmc.edu, and we can add you to that list. But we will be in contact soon. Thank you so very much for joining, and have a wonderful rest of your day.
Thank you. Have a great day.